Thank you for taking the time to watch this webinar. My name is Emma Mamo and I'm Head of Workplace Wellbeing at Mind, the mental health charity. Mind provides advice and support to empower anyone experiencing a mental health problem. We also campaign to improve services, raise awareness and promote understanding of mental health. Mind is leading a major new project called the Blue Light Programme, which is dedicated to helping support the mental health of emergency service personnel, so staff and volunteers working within the ambulance service, fire and rescue, police, and then also the search and rescue services all across England. The programme will focus on raising awareness and tackling stigma within the services, and then building resilience to help ambulance personnel manage their mental health at work, providing training for managers so they're better able to support the staff that they oversee, and then providing information and support to all who need it. This webinar and others in the series have been made specifically for emergency service personnel, and joining us to share his experience of managing his mental health and wellbeing whilst working for the ambulance service is Hemingway, a paramedic with Yorkshire Ambulance Service. In this webinar we'll talk about what is mental wellbeing and what affects it, how to build resilience and stay mentally well, and then sharing tips on managing your mental wellbeing at work, and of course hearing from Neil about his experiences. So what does affect our mental wellbeing? Well, our mental wellbeing describes our mental state, how we're feeling and how well we can cope with day-to-day life. And our well-being and our sense of our mental well-being can change from day to day, month to month or year to year. If you have good mental well-being, or good mental health if you want to call it that, you're usually able to feel relatively confident in yourself and judge yourself on realistic and reasonable standards. You can feel and express a range of emotions, and you can also feel engaged with the world around you and build and maintain positive relationships and contribute to your community. And you're also able to live and work productively. And you can also cope with the stresses of daily life, including managing times of change and uncertainty. In terms of poor mental health, we all have times when we do experience low mental well-being and we feel sad or stressed or just find it difficult to cope. And these can be due to life events such as bereavement or relationship breakdown or just a change in our circumstances. But sometimes there is no obvious reason why we might experience poor mental health. However, we do know there are some common factors or triggers that can lead to experiencing a period of low mood and so on. So this could be living with a long-term physical health condition that can have an impact on you. As I stated before, changes in your circumstances relating to relationships or financial issues or poor living conditions. And then also if you're out of work for some time and this feeling of social isolation or loneliness. And then also if you're caring for a family member or friend who might be living with a physical health condition or dealing with some other issue, and that can have quite an impact on your mental health, providing that kind of support. And then if you experience significant trauma as an adult, such as being involved or witnessing a serious incident or being the victim of a violent crime. We also asked ambulance service personnel to share with us with what factors can cause them to experience poor mental health at work, and what they shared with us included having to kind of take call out after call out after call out and having quite a quick turnaround between handing patients off at A&E. So that can obviously have a massive impact on your resilience, just having to work at that kind of high pace. And then also you don't have a time, potentially if it was a difficult call to then, a difficult call out to then process that and debrief afterwards and have some downtime. So that can obviously have an impact on your mental health. And there had been a move from ambulance personnel working in pairs in ambulances to them being lone responders. So for some people, they could work a complete shift without seeing anyone. That feeling of social isolation again can cause poor mental health or stress and so on. And then obviously just witnessing patients that have been neglected or badly assaulted, and then obviously just dealing with deaths and the impact that traumatic events can have on you. And then just maybe what people said to us, just this culmination of events, just this daily grind of seeing maybe low-level distressing events, but the build-up of that can just really have an impact. And then as we said, not having the opportunity to share these experiences with anyone on shift or debrief after you've found something challenging. And then also if you're having those quite long shifts, it's quite hard for you guys to take breaks and get food, get something to eat. And obviously that can impact on your energy levels, which then can impact on your mood. And then if you're having to rely on, a quick bite or a takeaway type meal, again, we know that's not healthy for your physical health, which obviously has an impact on your mental health. And then I guess maybe if there are instances where you lose someone and that feeling of guilt or responsibility that you might have linked to that. And then also just the fact that you're working shift work, you know, evenings, weekends, and that's time away from your family, and just juggling all of that and potentially maybe neglecting yourself because you still want to, you know, give time to your family. So where does your time take the hit? Well, personal time. And then just the heavy workload that you guys are experiencing now and so on. And then people also shared, you know, the worries about being disciplined for making any errors, and then being, you know, measured against response rates rather than the actual clinical care that you've provided.
Yes, yeah.
So does that sound about right?
It does, yes, yeah, it does. In many ways, there's a lot of points there that are very true. Very true. A lot of the main points are there.
The main points, and that obviously, considering how much time you spend at work, can have a significant impact on your well-being.
Yes.
So just talking about, you know, Mind's Blue Light programme and the research that we carried out to inform the programme, we know that 1 in 4 people will experience a mental health problem in any given year, and there's around 220,000 staff and volunteers working within the emergency services across England. So you could say 1 in 4 will probably be experiencing poor mental health at any time. But because of the challenging nature of your roles, potentially there might be a higher prevalence. But what we actually found is that 87% of personnel said they had experienced stress and poor mental health whilst working within the emergency services, which is quite worrying. So that does seem to suggest that, you know, the challenging nature of your roles and the fact that you do see, you know, traumatic events and so on means that you are potentially more vulnerable to experiencing a mental health problem. But what's interesting is that we found that emergency service personnel are quite reluctant to take time off for poor mental health. So they kind of hold it together at work, but then it seems to have a massive impact in their home lives and in their personal relationships and so on, which was quite an interesting finding, I felt. You know, it's that idea that, you know, you're less likely to take time off even though you might need that time to recuperate. And that might be because, you know, stigma about saying you're experiencing a problem, but also maybe your responsibility to your fellow co-workers. You know, we're quite under-resourced. I don't feel like I can take time off. I'll be adding more of a burden even. So that's quite a concern. Do you think that's potentially an issue? Or?
I think that's true, yes. And also each and every job in itself is slightly different.
Right.
And that adds to the mental strain, what you have to think about in regards to we're a professional body now. We are judged. No, not judged. We've always been responsible for the patient's clinical well-being. And that's at the forefront of every ambulance person's mind. But when you're working job after job after job with very little breaks, the pressure increases each time you go out to a point where, as you say, you put up with it, you shut up, but you get on. You just keep on going.
I guess for me, if I'm experiencing stress or that feeling of, like, you know, extreme pressure, I get a kind of fuzzy head and I can't make good decisions. But if you're an ambulance, you know, personnel, you know, that you're making decisions about how to provide the best care, so that can probably have quite a massive impact. And as you say, you hold it together and you do job after job after job, but there is a point when that is gonna, you know, it's gonna tip over. You
do have to be on the ball at the start of your shift and at the end of your shift.
That peak performance at all.
You've got to keep it that professionalism, that high treatment, that standard that you've got to deliver. And as I say, when fatigue, tiredness, it's 2 o'clock, 3 o'clock, 4 o'clock in the morning comes in, you're absolutely shattered out on your feet. But you go to a situation that you have to decide on the course of treatment for a patient. It has to be the right course of treatment. That's when mistakes can happen. Problems can, you know, catch up with you. You're not at the height of your thinking potential really at those times. 12-hour shifts coming towards the end of it, then you get a late job which takes you into your 13th, 14th, 15th
because you'd have to stay on
hour.
Potentially.
That's right, yes, yeah. In North Yorkshire with our area, we have a large area to cover, and sometimes people can be sometimes into the 15th hour before they've finished work.
Wow.
But you've got to be alert all the time throughout that treatment.
Yeah, so it can take quite a toll. what we know is that, if you experience low levels of mental well-being over a long period of time, you are more likely to develop a mental health problem. And then if you are living with a mental health problem such as depression or anxiety already, you are more likely to experience periods of low mental well-being than someone who hasn't. However, you can still have periods of good mental health where you are able to manage your condition in your life without becoming unwell. So it's important to know that just because you experience a mental health problem, it doesn't mean you can't live a full and successful life. But I guess what we all need to know better is, well, what keeps me well? So what do I need to do to keep me well? And then also, if I am starting to struggle, what does that look like for me and what kind of support do I need? So I guess that's quite important for emergency service personnel and everyone. What I would say is, whether you have a mental health condition or not, there may be times or situations in your life that are more difficult than others, and the capacity to stay mentally well during those times is called resilience. Mind's model of resilience kind of outlines a three-pronged approach, if you will. So you have to do stuff that promotes a sense of well-being in yourself, and then you have to build your social capital, and then you also have to apply psychological coping strategies. So I'm now going to outline some of the ways that people might be able to develop and strengthen their resilience so that they can deal with everyday life and then also face difficult situations without becoming unwell. But what I will say is, we're all individual, and there may be other things that are helpful for people. So it's more about just trying to think this stuff through and take note of what works for you and build that into your everyday life. But in terms of, promoting well-being or a sense of well-being in yourself, we know that looking after your physical health is really important. So getting good sleep, eating healthily, and then doing physical activity has a massive impact on your sense of well-being. And then also, doing stuff that you enjoy, whether that's cooking, gardening, walking the dog, spending time with your friends. Just make sure you're making enough time to do that so you get that sense of work-life balance. And then we also know doing something for others. I mean, obviously, anybody working within the emergency services is already in a role which is about, providing a service and serving the community. But, we also know that giving and volunteering in other ways can also be helpful for people in terms of their mental well-being. And then I think also being kind to yourself. I think, you guys do work in quite challenging roles and you do make life or death decisions, but I think it's just, reflecting on successes and not always being that harshest critic. And then in terms of building social capital, what we mean here is just about having, a network of close relationships and, positive relationships with people that you can draw on in times of need. So, building relationships with, your family, friends, but colleagues. I think it seems to be a real sense of community within the ambulance service. And then being able to talk about the way you're feeling if you are struggling, again, to those close people around you, or potentially employee assistance program. Do most ambulance services provide that service? So a kind of confidential line people can call and maybe access counselling through?
We haven't got a confidential line.
Okay.
I can only speak from our service.
From your service?
We don't have a confidential line. If we feel like we need support in any way, then we have to, first of all, we can refer ourselves to the occupational health.
Okay.
But then the actual official support begins when the line manager says yes. So it has, or you can go through the line manager first. Okay. Which is sometimes not the best way to go.
It can be a bit of a barrier.
That's right. It can be the first barrier for the first step when people need help.
Okay. Yeah, and I mean, do you feel that line managers kind of ask people, how are you doing, and have regular check-ins, which then would help open up the conversation?
I think the line managers are, we were speaking earlier about line managers, executive directors, they have their own stress-related problems. And it would be, on the road staff, we have our stressful related problems. We have our times of upset and need when we can approach our colleagues. Some people don't even have that on the service. They're not close to anybody. They have a working relationship, but not one that they can open up to.
So there isn't a kind of relationship where there's a supervisor who has kind of responsibility for their welfare?
Not really. You have to look after yourself. Okay. And that's the problem that I came up with, really.
Okay. Well, we're going to hear about your
Okay,
experiences
yeah.
in a moment, but yeah, I think that kind of shines a light on where there's a bit of an issue, because you need to create a culture where people feel comfortable seeking help, but some
right.
people can feel that that's not possible for them.
No.
They can find that a real struggle. So then you need to have the kind of opportunities or the systems and processes where you're kind of picking up that someone might be struggling, or there are other ways for which they can access support, either peer support and so on.
That's right. So with the point that mind for the sort of the mind welfare, when you've done a 12-hour shift, you want to go home, you don't want to go out, you just don't have the ability sometimes, the physical, you're just so tired, you just can't do it. And after a long period of 4, 5, 6 shifts, of 12-hour shifts, nights mixed in with days, all you want to do for your first day, 2 days is nothing.
Yeah.
It's just
To completely decompress.
yeah, that's right, because it takes you a while to slow down.
Right. Yeah, if you're working that kind
And that's
of pace.
it, yeah.
Well, I mean, the third part of our approach to, how you build your own resilience and manage your own mental health is around psychological coping strategies. So people, can find it useful to build in meditation, or build in, periods where they practice mindfulness. So that idea about being present in the moment and focusing, and then just kind of, just building in pauses in your life, because that helps counter that kind of very fast pace. So that could be helpful for people. And then also other psychological coping strategies are around talking treatment, so people can go for cognitive behavioural therapy, or just can help them counter, negative thinking that they may have started experiencing. So yeah, there are a few things that people can do. In terms of then managing your mental health at work, as we've identified, working in the ambulance service and the emergency service as a whole, it's a high pressurised job. So you need to feel confident and motivated to perform well in your job, and that is about, being able to effectively engage with and support your colleagues, and still being able to undertake your duties and so on. So I'm going to outline some following suggestions. It'd be good to get your view on, what's possible, and also what works for you. So yeah, these are things that might help you to manage your mental health, or indeed help you if you are struggling. So, linking what we said about social capital, so develop and maintain good relationships with colleagues so you can build up a network of support. Use the time between home and work to have some downtime and maintain a life outside of work, and that kind of sense of, as we said, de-stressing. And then plan your leave and take it, so again, that whole feeling of work-life balance, it doesn't just feel unending. And if you are provided with opportunities to have some input into how the service operates, particularly in decisions that may impact you, then take advantage of these opportunities. Do you feel within the ambulance service people can kind of have a staff voice and kind of influence because there's a lot of change at the moment within the service?
There is, yes. Within the service, we've started a health and wellbeing group, where we are looking at and actually working towards a better physical and mental health structure for staff.
Okay.
We're looking at ways to build support for our service, whichever part of the service you're in, from the call takers to the dispatchers, through the management structure to the road staff, everything. Each person within the service should be able to get that help that they needed at source, be it peer level, be it professional bodies. So that is, it's been constructed slowly but surely, but it's getting there, and there is a lot more people out there asking the questions.
Well, that's really positive, because that's what's really important, to give staff a sense of ownership about this. So that's good in terms of the support that's provided. So then linked to that, what I was then going to suggest is, if there are work issues, that people can find a way to voice their frustrations, but in a constructive way. So do you feel like there are structures that help staff raise issues if there are kind of operating practices or so on that are just unhelpful?
Yeah, there is practice and measures in there that we can, if anything does go wrong, we can report it. There is structures behind there. Physically and mentally, that's when the problems start to happen.
Okay.
We can, if a person hurts himself physically, you can see an injury, a fracture, a cut or whatever. If it's mental, it's very, very rarely brought to the table straight away.
Okay.
It's like you said earlier, with the stigmatism of it all, within the emergency service, it's a matter of, you know, sort of man up and get on with the job. You know, you'll deal with it later, and you don't have the time to deal with it at that time.
Okay.
You just don't. You don't. And when you go away from from your shift on that day, you don't want to think about what you've done. You want to try and get away from it. That's right, yeah. And as I say, there's policies for reporting lots of different things. We've got the HCPC is a registered body, professional body that all paramedics are registered with. If we think we're unfit to do the job, if we're having problems with the job in any way, we can report it to that external organisation as well.
And they can then advocate for you.
They can advocate for us, or they will investigate it and say whether you do need help, you know, whether you don't need help, and that's when it starts to get really stressful.
Okay.
As it happened with myself.
Right. Okay. Yeah. Then in just terms of some general pointers, you know, just being able to learn to say no if demands are unreasonable, but that can be quite challenging, I guess. And then linked to that is, you know, don't be afraid to ask for help. You know, if you feel work is spiralling out of control, you know, take the opportunity to discuss it with your manager and your colleagues. You know, delegate tasks if you can, you know, share that out and don't try to do everything yourself. And if you can't resolve the problem of unrealistic expectations, then, you know, talking to colleagues in HR or your professional body or other relevant members of staff so they can kind of advocate for you would be helpful. And then in terms of, you know, those periods, you know, going through a tough time, you know, we all experience tough times, and I think it's important not to put too much pressure on yourself to kind of carry on as normal. You know, this will have an impact on you, and you may need to take some time out and take some time away from the job. You know, that could just be 5-10 minutes, you know, going for a walk around the block, or it may be that you need to take some time off. And again, what we were saying, you know, say no to requests being made of you if it does feel too much. And linked to what we were saying earlier around, you know, getting enough sleep and rest when you can, and being mindful of eating healthily, especially during prolonged shifts, should help. And then, as I was saying, you know, learn to accept that you don't have to be perfect and in control at all times. But if you ever do get to that point where you are feeling overwhelmed, then taking action, however small, will help you. So you may be able to do some of the following things I'm going to outline, just, you know, off your own accord, but others you might need to negotiate with your colleague, supervisor or manager. But, you know, as I said, take control by being proactive. You know, think about what you need, what support you might need. Talk to someone you trust at work or outside, you know, about what's distressing you and what's making you feel stressed. And then speak up if you need help. And again, you know, saying no and being assertive if you need to. And then if it does start to feel overwhelming, you know, take a deep breath. Exercise and daylight can be really good for you at this point. So, you know, going for a walk and getting out would be helpful. And then making sure you drink enough water and that you remember to eat during the day. And then also a great antidote to stress is, you know, relaxation. So learning some relaxation techniques. We have a mind guide on the website called How to Manage Stress, which has some useful techniques that you can do at work. And what I will say, there is a range of support available for anyone wanting to talk to someone about their mental well-being or about any concerns that you may have, you know, whether it is work issues or relationship or, you know, health, money, whatever. Obviously, reaching out and speaking to someone in your workplace, you know, your supervisor, your team leader, and so on, you know, this is going to be most beneficial if they are aware of mental health and also, you know, the interaction between work and mental health, and they can be well informed about how to respond. So a large part of what the Blue Light programme is trying to achieve is to ensure ambulance services promote a more open culture of acceptance around mental health and can kind of give the right kind of support at the right time, although it sounds like, you know, there are, you know, things have already been put in place, so that's really positive. And then outside of work, you know, if you are more comfortable seeking support that way, you know, obviously going to your GP or calling Mind's Blue Light Info line, which is a telephone service which can direct you to support services in your local area, will be helpful. And details of that and other sources of support will be given at the end of this webinar. But we've already heard a little bit from Neil, but it'd be great now to hear more from you about your experiences of managing your mental health while working within the ambulance service.
My name's Neil Hemingway. I've been in ambulance service now for 35 years, 26 of them as a paramedic. Like many who work in the emergency services, we come up against more than the average incidents of heightened stress levels that thankfully the general public don't come in contact with in any way, shape or form. With this in mind, this is my story. I've lived with mental health issues now I can recognise for many years. And sadly, they are all related to the job I do, and sadly, a job that I still love. I'd seen my doctor on and off for years. I'd also had counselling through the service. Through the counselling, I felt that my problems were all related to just feeling down, depressed, just the average run-of-the-mill stuff. I never had a proper mental health diagnosis of my problem. And I just kept going on, putting up with it and carrying on. This was the downfall of my life so far. Through counselling, I was able to talk through some of the issues. And at the time, I believe these sessions really had helped me. They had helped me understand the burdens I were carrying on with me, carrying around with me. They helped me go through the thoughts that I was constantly going through. I thought it had helped, but I don't think it really did. I'm not saying that counselling doesn't help, it just didn't help me, and I feel now it slowed down my healing.
Why do you think that is?
I believe that I'd dealt with the issues, I'd sorted them out, I'd come to terms with them, I'd put them away, and they were all finished and done with. But they hadn't been. They hadn't been, and that was because of the mental health problem that I later found out that I had.
So you were seeing it in terms of those incidents, but actually you needed to maybe learn some strategies about
Yes,
managing your mental health in a kind of ongoing way.
that's right, and
Okay.
it was a problem that I thought I'd put them in the boxes
Right.
and put them away, but they were still pushing the way out. They really were.
Okay.
Yeah. Only 3 years ago, my wife started saying to me, "Why are you so moody? Why are you angry?
Mm-hmm.
Why are you going from happy and laughing to moody to argumentative, really aggressive?" And I just said to her, "I'm fine. I'm okay. There's nothing wrong with me." And I put this barrier up. I'm fine, I'm okay. It was always the same, you know, there's nothing wrong with me, I'm fine, I'll just carry on. She knew there was a problem, but I was unable to see it. I just couldn't see it. I was blinkered, I didn't see things as they really were.
Mm-hmm.
I knew I was having flashbacks. I was reliving incidents, experiences from years ago. I was woken at night. I was sweating, screaming sometimes, wondering what the hell was happening. I was so scared and frightened sometimes I couldn't sleep. And for a period of time, a long time, longer than I like to remember, I don't think I slept a full night for more than 3 or 4 hours. I was constantly being woken up with these dreams, with these flashbacks. My wife thought I was just, you know, I just couldn't settle. I just, you know, couldn't get to sleep. Change pillows, change mattresses, you know, everything to try and get a good night's sleep. I could be in town sometimes, walking with the grandchildren, and I'd get a smell of diesel. And from being with the grandkids, I'd be somewhere else. I'd be in that car with that lady. I could hear things, I could smell things, I could taste things, I could see things of that incident.
So it's quite triggering for you.
It's very triggering, and it wasn't just the one incident. There was so many more.
Mm-hmm.
This went on for so many years. I don't, and it just got worse. These were the things that I thought I'd put away, locked up, thrown away the key.
Mm.
As I said to you, I didn't sleep through these. I was slowly being dragged down to a point where I thought I was functioning normally, but I wasn't. It was horrible. I just wasn't me anymore. It was so frustrating and cold. Yeah, I was lonely. And I don't mean lonely like when you've got no plans for the night out.
Yeah.
You think you sat there thinking, there's nothing on the telly, what am I going to do, and things like that. I couldn't speak to anybody about this loneliness, these feelings, these sensations I was getting, even to me, to my wife, to my family,
Yeah.
to people really at work.
So it's more like you felt alone.
Yeah.
And isolated.
And, it was so lonely. I just felt I was so alone. It's a loneliness it debilitated me. It really knocked me. And sometimes I even felt like, would I be better off not here? It crushed everything in my life to the point where it actually split my wife and I up through how I was behaving, the things I did, what I said. I was a totally not the same person through these things that were happening. It's still hard to think now, and each time I go back, I still revisit those places. I'm certainly not as lonely now, thank God. I had a colleague who kept asking the same questions that my wife asked me. Are you okay? What's the matter? You're great with that patient, you're angry with that patient, what's wrong? Excuse me. And I don't know what it was, whether it was a dogma that she kept on asking me. Mm-hmm. I couldn't really get away from it. I couldn't, like at home, I could walk out, I could go do something else. I couldn't get away with it to a point where I opened up to her, told her what was happening. At work, people used to joke on that she was my carer. It got to a point like that, and if only they knew what she did, how she was with me. I continued going to work. I thought I was all right. I thought I was doing my job well, until I made a mistake. It wasn't a life-threatening one, but it was one that made me stop. And that day I broke down. It just took my feet away. I realised that the job I was doing, I was just going through the motions. I wasn't connecting with the job at all. And the rest for months after just feels like a dream, really. I got some more counselling through the service. Fantastic. But after a few sessions, the counsellor said, I can't do anything for you. You need help.
Okay.
And I thought, oh my God, even she's given up on me. I thought, there's nothing there now for me. She referred me back to the service occupational health, who looked into me getting some more treatment, while this was happening, I went to see the doctor again. And this time I actually told the doctor everything.
Right.
Not what I wanted them to hear.
No editing.
No
Yeah.
editing. I could actually say my feelings, what I'd gone through, what I am going through. The doctor put me then in touch with the mental health in the area. And after a few visits, they put me in touch with the IAPS organisation, who deal with a lot of military and issues related to mental health. I had a telephone conversation with a guy. I forget his name, and I feel awful for it, but he actually stopped me midway through. He said, "You've got PTSD." I says, "All right." I said, "I've heard about it, I've thought about it, but what makes you think that, you know?" And he gave me a long list of things. And he says, "This is the treatment you need." He says, "But unfortunately, we can't help you." So again, I thought, someone else giving up on me. But they couldn't deal with it because I had multiple things that were happening, multiple events that were sort of there. Excuse me. With this in mind, the occupational health, I told them all about it. I was totally open with my manager and with everything what was going on, because that's just the way I felt. I just gave up basically. They took me in touch with a gentleman who gave me some EMDR treatment.
Okay.
And I forget what it stands for now. But I went there for 3 months, had 3 months treatment there, every other day. And it was the hardest thing I have ever done in my life. Going there, reliving everything, going over things so many times. And after those 3 months, I actually felt like I was getting better. And since then, I look back over my service years and I think, well, I've known 5 or 6 people who have taken their own life. And I think, have they gone through what I went through? Did they get to a point where they didn't have anyone to turn to? They didn't have anyone to go to. They felt like everybody had given up on them. Whether they were going through the same things as what I went through, I don't know, but it's a sobering thought, and really that's why I'm here, to share my feelings, what I went through, just to let people know, you know, that there is help out there.
You can come through it.
You can come through it. I've still got a monster there inside of me. I still get tearful. I still get angry with myself on how I've let it ruin my life, my relationships in the past. I just want people to know that, you know, there's people out there who are going through the same thing, who have gone through it. We need to get something together to talk and, you know, let people see. And I just don't want... I'm not going to go through the suffering. I pray to God I'll never go through the suffering again that I've been through. And I don't want other people. And when people ask you, what's wrong? You've just got to stop and think. You know, what are they saying? What are they saying this for? Just stop and think.
It can be quite difficult when you're in the middle of it, though.
Oh gosh, yes, yeah. And you've just got to think that, you know, you've got to... they're seeing something that I'm not seeing. Don't get angry with them.
Yeah.
Ask yourself the question, am I all right?
Yeah.
You know, and don't be frightened of your answer you might get. It's hard. It's very, very hard. I just want people to get early intervention in the putting the hand up and saying, yeah, there is something wrong. Getting the right diagnosis, and then they can get the right treatment.
At the right time, yeah.
At the right time, before it's too late, and then there's another name on that list.
I think that's something that a lot of people across the services, so I was talking to someone within the fire and rescue, but also police and so on, and they've said that there's things are improving, mental health within the emergency services. There is improvements in how people talk about it, but they said the biggest thing that the programme could do over the next year is to make it okay to say you're not okay.
That's right.
And that's why people, you know, who've worked in the service, who've gone through these kind of experiences, it is really important for you guys to come and share what you've been through and say, this is what helped me, this isn't what helped me, and this is what I've learned, and this is how I manage it now, to kind of show that this does happen. It does happen to other people. It happens to us, me, you, and just make it more normalised.
And I'm completely a personality's open, it's bouncy, it's happy, it's out there, it's approachable, but that's something that you put on. And people know me, you know, they'll probably see this and they'll think, I didn't know you were like that. And that's what I want, is them to say, I didn't know you were like that. You know, and I wonder how so-and-so is, and I wonder, you know, he's you know, had his troubles recently. I'll have a chat with him, see if they're all right. Yeah. Since I started this story, I've spoken to many people about this issue, and so many have recognised similar things in their life. I say to them, take back control. Yeah. You're not weak for saying you need help. There is light at the end of the tunnel, like we said. I've been in the longest, darkest tunnel ever. Listen to others, listen to yourself, and ask yourself the question, am I okay? Don't ignore the answer you may give yourself. Yeah. No, I think that's really important, but I think it is also about, you know, the other things that we're doing within the programme. So, you know, team leaders and supervisors are asking the question and kind of creating a culture, which helps that, because it can be difficult if you are in that tough time to ask for help, and it can be hard to kind of seek support. So it needs to be, you know, both that you can create the kind of culture where people can feel safe to say that they're not doing very well, that they are struggling, but then also the fact that you are kind of building in these kind of check-ins and these temperature checks, if you will, and just these kind of just to open up the conversation, are you okay? And then for people to feel comfortable. So so I just want to say, you know, thank you for kind of taking part in the webinar and sharing that, because I can see how personal that was, and still quite emotional for you. It is. Thank you for doing that. We really appreciate that. And as I said, I really do think that having, you know, emergency service personnel front and centre in this programme will kind of show that it's okay to talk about these issues. You know, we hope you have found viewing this webinar helpful. We have produced additional webinars in this series, one called Mental Health Awareness, which talks about, you know, just you know, mental health conditions, what this can look like for someone, and then how to support someone in distress, be that a colleague or be that, you know, general public that you might be supporting in your day job. And then also, you know, managing mental health in the workplace, which is more for supervisors, you know, senior management and so on, about how they can create the right kind of culture and have the right kind of organisational approach to these issues. And, you know, both of which are available to view now, so please do have a look at them. And also, please take a few moments to give us your feedback by completing the short survey that will immediately follow this webinar. It's really important for us to get feedback about, you know, what we're producing, so we can make sure the programme meets your needs. We've also created information booklets and other resources specifically for the blue light services that cover these topics in more detail. So these are available to you and your colleagues, so please share the guidance as it may be of help to someone.
And again, please note the details for all the information and support services that are available, including mine's dedicated blue light info line. So that's available at the end of this webinar. We are determined to reach as many emergency service personnel as possible, so please ensure your colleagues are made aware of the Blue Light programme as a whole, and then the support and services available within it, and then of course these webinars. Thank you for watching, and thank you, Neil.
Thank you.